In part 4 of Neoplasia lecture, we will look at cancer incidence. Cancers are the second most common cause of death in children after accidents. Most common cancer in children are acute lymphoblastic leukemia, accounting for 33% of cancers in children. After that, there's medulloblastoma, neuroblastomas, and Wilms tumor. These are not common tumors in adults. The cancers that are common in men in decreasing order are prostate, lung, and colorectal, whereas in women are breast, lung, and colorectal cancers. Gynecologic cancers in descending orders are endometrial cancers, ovarian cancers, and cervical cancers. Cervical cancers are decreasing in incidence because of cervical pap smears detecting dysplasia. Now we look at cancer-related death. The most common cause of cancer death in adults are lung cancer. Cancer-related deaths in men in decreasing orders are lung cancers, prostate cancers, and colorectal cancers, whereas cancer-related deaths in women in decreasing orders are the lung cancer, breast cancer, and colorectal cancers. Gynecologic cancer-related deaths are ovarian cancers, endometrial cancers, and cervical cancers. There are some cancers that are inherited among family members, and this accounts for 5% of all cancers. The categories of inherited cancers are autosomal dominant cancer syndromes and autosomal recessive disorders involving DNA repair. Examples of autosomal dominant cancer syndromes are retinoblastoma, familial adenomatous polyposis, Li-Fraumeni syndrome, BRCA1 and BRCA2 gene. The autosomal recessive disorders involving DNA repair includes xeroderma pigmentosum. There are familial cancers with no defined pattern of inheritance, but the cancers develop with increased frequency in families, and this sometimes involves the BRCA1 and BRCA2 genes. Carcinogenic agents are agents with the capacity to cause cancer in humans. They can be chemicals, which can be direct or indirect acting, such as asbestos and benzene. They can be microorganisms, such as virus, bacteria, and some parasites. There can be radiation, either ionizing radiation or UV light, or it can be physical injury, either by burns or chronic inflammation, etc. The IARC, the International Agency for Research on Cancer, divides the carcinogens into 5 groups. Group 1, which is carcinogenic to humans, such as smoking, exposure to solar radiation, alcoholic beverages, and processed meats. Group 2A is probably carcinogenic to humans. Group 2B, possibly carcinogenic to humans. Group 3, carcinogenicity, not classifiable. And Group 4, probably not carcinogen. Some cancers are associated with geography. Worldwide, malignant melanoma is the most rapidly increasing cancer and can be seen everywhere in the world. In Malaysia, nasopharyngeal carcinoma is quite common, secondary to Epstein-Barr virus. In Japan, stomach adenocarcinoma is common due to the ingestion of smoked foods. In Southeast Asia, hepatocellular carcinoma is quite common because of hepatitis B viral infection plus the exposure to aflatoxin produced by Aspergillus in food. In Africa, Burkitt's lymphoma is quite common due to Epstein-Barr virus infection, and Kaposi sarcoma due to human herpes virus 8 infection. So, gastric cancer is associated with Helicobacter pylori, and you can see the Helicobacter pylori is present here. Liver cancer can be associated with hepatitis B viral infection, and that can cause cirrhosis. And this is the tumor in the liver. You can see that it is malignant because it is not circumscribed. It has a very irregular margin, so means that it is invading into the surrounding tissue. There's a lot of hemorrhage you can see here because the tumor might be invading into its own blood supply. That causes hemorrhage. This is a picture of the thyroid, and this is thyroid cancer. This can be due to exposure to radiation. So radiation is also a carcinogen.